Good evening, everyone. My name is Brenda Ahlberg, Kenai Peninsula Borough Information Officer. And tonight with me is Dan Nelson, our Incident Commander, here to provide you an update on our COVID-19 response, as well as other things that are going on related to the response activities. Good evening, Dan. How are you doing tonight?
Oh, I'm doing well, Brenda. Good evening, and good evening to all. Thanks so much for joining us. Hope you had a very wonderful Easter weekend. I think all of us here did, and we had some good work, and kind of being able to slow down just a bit and deal with some of the things that have been happening, and I hope that most of you got a break from COVID-19 and got to enjoy at least maybe some virtual family time or however that ended up working. I know Easter probably looked a little bit different than it normally did. So let me give you a little bit of an update on what your borough is doing, and along with the cities and all of our healthcare partners. Things have been busy, but they have been steady, and we're in definitely that marathon that we've talked about. As far as cases, our daily update for today shows a total of 285 cases statewide. Here on the Kenai Peninsula, our case count has remained unchanged, so that's 15 cases attributed to the Kenai Peninsula. So definitely some good things in that data, and we'll see as things change. Basically, from the state level, Dr. Zink has told us that we're doing well in flattening that curve, and really one of the keys to doing that is to continue doing what you're doing, continue with following some of the mandates and those things that have happened, because I think we've really seen that Alaskans have pulled together, and they've done the right thing, and we've got some good results. So uh, I will just say now is not the time to let up. As we look at different models and different things, we see that um, those models and those curves that continue to allow us to flatten that and to keep the healthcare system up and to keep people safe and healthy depend on us continuing to do that physical distancing and make sure that we're staying home, we're washing hands. You know everything. I'm not going to rehash it, but one thing that is very important is just being sure that this is not the time to let up. So lecture over for the day. Everybody will move on. So 15 cases in the Kenai Peninsula that remained unchanged. Some new mandates came out from the state of Alaska from the governor. Probably one of the most ones that affects the most people is going to be the one regarding elective medical procedures. So the suspension on elective procedures, those non-critical procedures, has been lifted, but that does not include dental work that isn't emergent at this time. So this is a good time if you had some of those things scheduled or pending. You can contact your medical provider and let them know and how they're going to be handling that, and as things kind of ramp up in the medical field. So something good for folks to be aware of. Contact your dentist, of course, for guidance on that dental work. What's that's emergent or not, and just work with your providers. As far as that goes, boy, we've had that's kind of the updates that we've had from the state level. The governor has certainly been working with administration and science and all of the subject matter experts to really try and provide a good response and to look at the data of different things. So, we'll encourage to keep looking for that guidance from Department of Health and Social Services and the state level to do that. So that is kind of a very, very quick update from the state side. From the borough side and the cities, hospitals, we're all pretty much on that same marathon path. So we're waiting for data to change. We're continuing to do the things we always have. We're preparing. I would say most of the preparations are at a very good state. We're getting there here probably, in fact, as of today, here at the borough level. Feel confident as we've worked with all of the hospitals that have done just an excellent job of making sure that we're ready if these numbers were to change and people needed that additional medical care, additional health care. I'm very, very confident in that right now. And like I say, if we do the right thing, I think these numbers will stay. And that's something that we've also been saying is that the best thing that can happen is nothing. So I think we talk about Murphy's Law. If we prepare and we plan ahead, well, maybe none of that stuff shows up. But I think if we didn't prepare, then the opposite would be true. So, again, just a thank you to everybody, all of the healthcare workers, the doctors, the nurses, people working in hospitals, first responders, our EMS, our fire departments. Really, we've had so many people that have contributed to this response and to making sure that we're all safe and there are contingency plans in place. And then that extends into the community, those people that have made masks, those people that have donated personal protective equipment. It's really a great thing to see. So on behalf of everybody, my thanks to everyone that has really contributed to that. So that's a little bit of an update from the state side and the borough side, and I think all of our cities are doing the same thing. So not a whole lot of specific things to say, but everybody's kind of still staying ready and still staying in that mode of being able to respond as things change, and certainly hoping that this trend continues.
A question I have to ask, Dan, is with regards to the elective medical procedures that are now being allowed, not dental, of course, is how is that going to affect people coming into the hospital? Are there any changes there? Are they still going to be required to be screened? What can people expect?
I think people we can get some information to double check this from our hospitals, but people should expect the same screening that we've been experiencing. And so at a lot of our hospitals, if you had business there, an appointment in the hospital, you might be asked some questions, make sure that for what you're there for, if you have symptoms, if you're experiencing any of those things, and that will continue for the foreseeable future. I can't really address the visitor policies. I imagine those may be looked at, but we can probably still expect that we want to do the right thing and limit the exposure of people and making sure we're keeping people safe. So it's likely we'll see that for the foreseeable future, even with some of these elective procedures. But what we'll do is we'll let folks know if the hospitals or the state comes out with any new guidance to change that.
Very good. And we've recognized lots of folks in one group that is a great asset to all of us that we oftentimes forget to address our dispatchers, our 911 dispatchers. They are truly the force behind all of us, and certainly want to reach out to them as well through all Absolutely. Of this.
No, that's a great point, and I'm probably going to get in a little bit of trouble having come from that world personally when starting my career. But those are the folks that we hear, but we never see, and we hear them not too often until we need them. So, like I say, dispatchers. In fact, I do believe it is National Telecommunicator Week. So I will shout out to them because I did not do that at the top. So these are all of our folks in the borough level and the cities that answer our 911 calls and be what they call the first responders. So thank you for that for everyone. And once again, just for everybody, I could probably take the whole broadcast and name those folks that really do a lot of things. And that even goes to you might have seen in social media. I think these are great posts where we recognize that even the folks in our restaurants or in our grocery stores are really on the front lines of this. They're still essential. They're still doing things. They're working hard every day through additional crowds and additional cleaning procedures and all of those things to make sure that we can get our groceries and our commodities. So really a hats off to all of the businesses that have been adjusting their processes or making things so we can still take advantage of that. And so it's a little bit of a good segue. I wanted to point out to folks one of the tools that we have available if you are looking for the status of businesses or wanting to see if some are open or what services they provide. And so I want to show that to you again real quick. So of course, as we always mention our blog, kpboem.com, you can find the COVID-19, the borough's COVID-19 information hub linked from there. So if you go to the kpboem.com, look at the column on your right, and you'll see that in just in the top choice, the top link there. And that's going to take you to our information hub that I'll show you here real quick. So this is the information hub. You'll see the statistics and some things similar to this, and really encourage folks to take a few minutes. I think it works well on your phone as well as your computer, your tablet. But if you go up here to Maps and click that link right there at the top, there's some great choices of different maps and things that you can look at and take advantage of. And when we talk about those facilities and those restaurants and businesses, if you look here at the restaurant, food and beverage services, and also general business and services map. So if you click on this, which we introduced here perhaps a week ago, you can look and do some different things here on what you want to look at. So we're looking at our restaurants and food and beverage. You can filter by different things. So the first thing you're going to see is pickup and delivery options. If you click on that and you're looking for a place to get a meal tonight, you can decide if you want to do curbside pickup, or delivery. You can filter by this. So if I say delivery only, that'll change the map. If you say curbside pickup or delivery, you can see back here that changes the map as well. So if I'm in the Central Peninsula area, if I just X out of this and zoom in, I can see, I'll zoom in a little bit more here. So let's go over to the Kenai area, and you can keep zooming in and go to the level you wish. But if you take a look at these and click on any one of these businesses, you'll see here that here we have curbside pickup and delivery, open from 11 a.m. To 9 a.m. and a phone number to get a hold of folks. So you can click for the website or Facebook, and all of this information. If I go to this one, we'll see what this looks like. And the same thing here, phone number, hours. All of this information is being filled by business owners and community members, and we're trying to really put all of this information into one source. So when you are looking for those businesses, when you are looking for something specific as it relates to COVID, you can get a hold of the information here on this hub. And if you go over here on the left, you'll see information that talks about click here to participate in some of this information. And this is a survey that'll open up. If you have a business, or if you want to list your information on here, all you need to do is go through this survey, fill the information out, and it will post to our map. So the first thing that you're always going to do is put in the address. And that'll pop up. You find the address for your business so the map knows where to put that information. And then you can put the business name, your status, and any of the information here, your hours, just like we saw on the other map. So really want to encourage folks, if you haven't submitted this information already, please take a moment to do that. And that way we can make this a useful tool for everybody. So once again, thank you to all the business owners, everybody that's been doing things in kind of a new way and modifying. And I know a lot of people have added deliveries, have added pickup, and you can call or text some places to go shopping. Thank you for coming up with ways to allow that physical distancing, but still allow us to patronize your business and get what we need. So just a real good tool there. kpboem.com, and then click on the information hub on the right-hand side. It's the first link.
So you were populating some of those maps, and in that is also a drop-down menu for testing sites. And if you don't mind describing how is that information generated, certainly it's not coming from the borough, but I think it'd be important for folks to see that as well.
Absolutely. And the testing site information that's on here is the borough doesn't have those health powers. So we don't coordinate testing ourselves. We leave that up to the hospitals and medical providers throughout the peninsula. But the State Department of Health and Social Services does provide maps to those testing facilities. So that information comes from the state. You will see some locations here on the Kenai Peninsula. I will just kind of be advised that I know some of those areas that are doing testing are not shown on that map. So we'll work with them. Again, that data comes from the state and not from us. So it may not be exhaustive, and it may not have all of those private providers. Do keep in mind that even though these testing sites are shown on the map, that many of our hospitals, I think all of our hospitals, do drive-through testing, or testing where somebody will come out and take care of the test for you, so you don't have to enter the hospital. Remember, we just talked about some of the visitor restrictions and some of the other things in our healthcare facilities to help keep people safe. So our hospitals are doing some of those things, but they may not specifically be identified on that map as a drive-through site. Remember that your healthcare provider must still refer you for a test. So the first step, even these testing facilities, you don't want to just go there and request a test. It doesn't work like that. So as a reminder, contact your healthcare provider, especially if you are showing symptoms. Call them on the phone first. They'll go through and they'll talk with you about your specific circumstance and give you guidance on what to do from there. So they may send you to their office or a particular hospital, whatever it happens to be. So there is different criteria that the state has put out to help people with that testing. Tests are still limited, although we are seeing, new tools and things that are potentially coming down the pike. Some of our facilities may have some of those things. Really, the key is start with your physician or your provider. Let them know what's going on. They'll walk you through that, and they'll let you know the best information for your area on where to get a test and give you that referral if they feel it's necessary. They may do some other testing or give you other advice as well. And really, I think that is the best key, is just to remember to deal with that, because every situation is different. So deal with your own provider and then go from there on their advice. But that information is on the map as a courtesy for folks provided by the state, and that's why it is there.
Thank you for that. A couple of questions have come into the comment thread. If you are up for some questions.
Absolutely, please do.
Okay, so one of the questions, of course, I have to wait till everything gets populated again, and my apologies, but does have to do here, just a moment. It always seems to happen. Kind of like Margie.
Well,
waiting on Brenda.
It's the technology thing. We're all bearing with it as best we can. If you were in if you saw us on last week, we did get our streaming fixed, so that's working a little bit better. So thank you everybody for your patience on that.
Mm-hmm. So with that, there's a comment here as far and you can help me with this. It has to do with the individual clinics that are doing testing. A person is saying that it is the responsibility of the entity to get that information to the state. I guess my question to you is how is that relative to our hospitals? Are they providing that information to the state? I know on the map we'd seen it, but is that the borough's responsibility?
No, it is the individual providers and goes through the health system. So, remember that the borough, unlike other counties or cities that may be in the lower 48, our borough does not have health powers. So we have our 2 hospital service areas, and those are contracted out to those organizations that run them. And so those are our medical professionals. They're the ones that are really plugged into that and really are dealing with the medical side of things. The Office of Emergency Management, the General Borough is, we make sure that basically those services are available. We help to keep the public informed. We communicate those things. We deal with, all hazard type of emergencies. But really, the healthcare side of this is really to be focused on those professionals that do this and are plugged into it. So the borough does not insert itself into medical things. It's really the easy way to say that. And we rely on the health networks and things, and the Department of Health and Social Services and those providers really have their own base and their own network, and they work quite well. So our hospitals are heavily involved in that. They coordinate with their clinics and, of course, other providers in each of the communities they serve to get that information up. So that's essentially how that works. That's all done on the medical side.
Another question, I don't know that you can answer it or not, but it has to do with, is the state letting up on some of these mandates? And I guess the question is why? Would you say that the state is letting up on these mandates?
I don't know if I would describe it that way. And I think there can be some interpretation of that. At the beginning of our broadcast this evening, we talked about how suspensions had been lifted for elective medical procedures. And I think what the state is doing, rather than saying they're letting up, is trying to be as intelligent and as responsible with data as they can to be able to allow for some things of our normal way of life to continue. But to say they're letting up in so much as we're talking about our physical distancing and our the hand washing and the what we should be doing, recommending we wear masks in public and those things. No, I don't think that that is the case from my interpretation about what the administration is saying. And as I said before, it needs to be said again and again. We've been in this now for about 5 weeks or so, 4 or 5 weeks, depending how you count. The curve is flattening. It seems to be the data we seem to be getting is good. In order for it to stay that way, we still have to follow these mandates, and we still have to be just as conscientious as ever, so we don't lose that curve and we start doing some of these things too early. So I would disagree with that characterization. I think making good, intelligent decisions. But again, now's not the time to be thinking about letting up on things. Now is the critical time to make sure we're still doing the right thing as Alaskans and keeping our healthcare system intact, keeping people safe and healthy.
Very well said. Thank you for that clarification. I appreciate that. I'm not seeing any more questions in the comment thread, but would like to talk to you a little bit about the plans to do a test on our notification system. And if you could share with us what that means and what folks need to do to prepare for that test.
Absolutely. Thanks so much for that. So we have our KPB Alerts notification system. So I know many of you are watching us here on Facebook, on KPB Alerts. You may follow our social media. But KPB Alerts is also a bigger telephone notification system, and we use that to be able to push out information during emergencies. And so many of you might have been here through some of the wildfires and some of those things that we've experienced over the past few years. We've taken advantage of that system. What it does, it allows us to put out a voice message or a text message or emails. There's so many different options, but it allows us to get to certain portions of our peninsula with urgent messaging. So this system is one that was put into place. We replaced it, I think, in 2018. We replaced that system with a new one called KPB Alerts. We've had some previous iterations of this in the past. And when we started putting that to use during some of our bigger widespread events, some of our tsunami warnings and earthquakes, we were starting to see some issues with it and being able to get people notified in a timely manner. And it sounds like a very, very simple thing, but it's really not when we're looking at our telephone infrastructure and this neighborhood or this community has good phones and good internet, but this community doesn't. And when you have some place as big as the Borough, it's a bit of a challenge. So we've been working very, very hard to try and improve that system. And there's several enhancements that the vendor that services that for us. So there's basically a back end of a vendor that takes care of the actual call delivery for us. We've been working with them diligently throughout, especially since the Swan Lake fire, where we identified a few more gaps. We think we've got it licked. So we think we've got a lot of these issues solved, but we need to do a test and we need your help. So what I'd like to do is just take a moment and ask everybody to help us tomorrow. So essentially what this is going to look like, and you may have experienced one of these tests before. We did one, I believe, in January. But you will receive on your landline, or if you've registered your cell phone with KPB Alerts, a phone call and a text message if you've opted into text messages. It's going to tell you it's a test, but we need your feedback to see how that worked for you. And so there will be a link up on our website. And you'll see that you'll see the kpboem.com address be put out there on Facebook and Twitter and on our blog. Tomorrow, that test will start at 11 a.m. and that'll probably run no more than 2 hours, but we'll give the system time to do what it needs to do. If you received a call, please let us know. If you didn't receive that phone call or that text, if you couldn't understand it, if everything went perfectly, please let us know, good or bad, what your experience was on this. And this is a short form. It'll take just a minute or so to fill out on our website. And what that does is that lets us check the data that the system is generating, because sometimes there have been some differences, and the system may say it delivered a phone call to you, but if it delivered a phone call and you couldn't understand the audio, that's like no phone call at all. So your feedback is what's going to help us do this. So Bullet points will recap tomorrow starting at 11 a.m. Everybody on the peninsula with a landline should receive that call. If you've registered your cell phone, you'll also receive a call. And if you opted into texts, you'll receive a text message. Please, when you get that call, when you don't get the call, if you haven't gotten that call by 1, please go on to that feedback form. The link will be on kpboem.com. That link, that address will be in the message. It'll be the article right on top of the screen. Please take a moment, help us make sure that our system is working for you. Help us make sure that all of the enhancements that we've done, we appreciate a couple minutes of your time tomorrow to answer that call, listen to the message, and give us that feedback. If you have any questions, you can certainly feel free to give us a call. We've got some of that information. We'll be going out on our social media and on our blog here tonight and tomorrow. But if you would let us know that, it would be really greatly appreciated. And that's going to help us make sure that this system is useful for, maybe this emergency, but also any further emergencies down the road. And I know we seem to have had our fair share lately. So we want to make sure that when we say we're going to call you, when we say we have urgent information, we're able to get that to you. So my thanks in advance for filling out that information. And again, expect a phone call from us tomorrow.
And for those that have very limited cell service that may wish to call our phone number, the 262 info number, just note that we have a few folks that'll be answering the phones. We're trying to keep ourselves physically distanced so that we're not in the same room trying to answer your call. If for some reason you don't get a person, it will roll to our message. You can leave your information regarding your call or what your findings were. So just bear in mind, there'll just be a few of us that will be able to answer phone calls tomorrow.
Absolutely. And if you do happen to leave a message, please just let us know your name. But importantly, we need to know the phone number that you're talking about and who your phone provider is. Those two pieces of information are essential. And then what you experienced. I didn't receive a call. I got my call, whatever that happens to be. If you are not registered, so if you have not taken the time to register your cell phone, so as I said, we have all the landlines. So the cell phones are really important, especially as many of us now only have cell phones in our home. You can go online to alerts.kpb.us, and there's links on our website, links on kpboem.com to follow, but just alerts.kpb, like Kenai Peninsula Borough, alerts.kpb.us. You're going to be asked to put in your physical address where you live. That'll have a Google map there to kind of confirm it. And then you can put in your phone numbers. And remember, you can register multiple phone numbers. So if you have 2 or 3 or 4 people in your household, register all of those phone numbers. And if you have more than one piece of property on the borough, register each address with those same phone numbers. It will not call you twice if for some reason we have both of those locations, but that way it'll make sure you get a notice. There is a checkbox to allow text notifications. So if you choose to have that, that's a great way for us to get information as well. It provides you a written record over a phone call. So if you are having texting availability, you can tick that box as well. So please register. If you have any questions, you can give us a call or follow some of the links on there, and we'll do that. So if you want to participate in the test tomorrow, you haven't registered yet, you've got time. So do that this evening.
Thank you. I'm not seeing any more questions in the comment thread. And so I would suggest that we go ahead and wrap this one up within our 30 minutes. And thank you so much for your time tonight, Dan. I'll punt to you for closing comments.
Well, thank you, Brenda. And yeah, we're right on time. So that's a great thing. And, that's a little bit of something about what I'd like to talk about is, as we've talked about before, we know that there can be a little bit of oversaturation about COVID-19, and as you're reading, news sources that you choose, or kind of just following along on social media, it seems that sometimes that's all we're talking about. That's part of the reason that we've taken these broadcasts down to twice a week. We don't want to overwhelm you, and so if you look at our social media, if you look at our blog, you're not going to see a whole lot of updates right now. We're doing this kind of intentionally. We want to be sure that you see things that are important and relevant to you, that you keep up to date, but we also don't want to just give you information for information's sake. We respect your time. your time is valuable. Know that we're continuing to work as best we can, but we're also doing it in a responsible way where, we're not um, putting a whole lot of resources into things when we're kind of in a little bit of a lull and waiting to see where things are. But I can assure you, as we meet with our cities and healthcare partners, and we touch base each morning, that everybody is doing their best and is ready for whatever comes our way, and hopefully we can keep that curve flattened. And we're going to do that by continuing to isolate physically, but also checking in socially with folks and with friends and family, and making sure that even as we're isolating, we're trying to be connected as best we can, hopefully using some of these tools like video conferencing and streaming and social media, and even a good old-fashioned telephone call. So we're going to continue to do that until conditions change, but please continue to monitor our social media, KPB Alerts on Facebook and Twitter, kpboem.com. On behalf of Mayor Pierce, on all of our cities and hospitals that are involved in this response, thank you so much for joining us tonight, and we'll see you Thursday at 7, and have a very great rest of your week.